So first off, I want to thank you guys for taking the time out of your days to spend with us and have what is a really important conversation, because essentially what we're seeing is the fight of two wars, this fight against COVID-19 and the fight against racial inequality, both of which are disproportionately impacting communities of color all around the world. So Dr. Gupta, Derrick Johnson, Brittany Packnett Cunningham, I want to thank you all for being with us today. And let's jump right in. Dr. Gupta, let's start with COVID-19. Why are communities of color around the world being so disproportionately impacted?
Thanks for that question. And to all the esteemed panelists, it's such a privilege to be here. Fundamentally, this pandemic has opened for everybody's eyes the systemic inequalities to healthcare access that have existed for decades. COVID-19 is opportunistic and preys on poverty. And we know what the color of poverty is worldwide. It's Black and brown. And that is why you're seeing communities of color in the United States, in the United Kingdom, across the global South, disproportionately affected. If you're an African-American male in the United States, you're 5 times more likely to die than if you're a Caucasian male from COVID-19. And simply put, there's a lot of reasons why we could talk about that, but it's healthcare access. It's us saying solutions to COVID-19 that every health expert likes to reel off the top of their tongue. Contact tracing, which requires a smartphone. Drive-through testing, which requires having a car. Social distancing, which requires you to have a job that allows you, in many cases, to telework. All these prescriptions that I've been guilty of stating repeatedly on time and again require affluence, some degree of economic independence, some degree to say, yes, I can do these things that are expected of me. And it's just fundamentally essential workers that can't telework, they're men and women of color. And that's the problem here.
And that's why conversations like these are so important. Brittany, I want to turn to you. Talk about the trauma in your body and your mind. What does that trauma look like on a day-to-day basis? How does it manifest?
That trauma manifests in expending excessive amounts of energy that you already don't have on doing the cognitive work of trying to get through the day. I can wake up in the morning and have a number of text messages, everything from folks who need to be bailed out of jail because they were treated unjustly during protests against racial injustice, or things that are related to COVID-19, folks being ill, trying to figure out how we get groceries into the house. I kiss my Black husband in the morning and worry about when he has to go out into the world, and that fear rests in my body. I worry about my Black godchildren and what they will encounter when they go out into the world, and how their innocence can be stripped away from them even though they deserve to be children too. That trauma manifests at every single moment of every single day, and it can really serve to shrink your world, because at every turn there can be danger, no matter what you have prepared for and no matter what you have predicted. Again, there is nothing wrong with my Blackness. What we are facing is the error of systems that were built to create winners and losers and to make sure that some people thrive while the rest of us struggle to survive.
Derrick, I want to turn to you because as the president and CEO of the NAACP, you are working with communities of color every single day. How are you seeing this trauma manifest?
But it manifests, as Brittany just mentioned, in everything we do. The neighborhoods we live in, our ability to access banking, access to health care, living in the midst of food deserts. Therefore, the quality of our food is lacking, to say the least. A child born in a certain zip code could permanently lock that child into a life of poverty because of the quality of education that that child can be provided. It reveals itself in everything we do. Its legacy is a decade and century long problem. It's something that for African Americans, NAACP being 111 years old, we started off fighting this fight as more young people bring energy to the conversation. It's a problem. It is an epidemic within a pandemic on top of the next pandemic, and it's long lasting.
You all have seen the hundreds of thousands of people taking to the streets after the video of George Floyd's death was caught on camera. You know, let's talk about the impact of these images. The images, on one hand, are so important to record the incidents, to prove that these incidents exist, And yet we hear that replaying the images are traumatic and damaging and create what someone else called the spectacle of Black death. So, how do we balance this need for protective evidence against the repetition of trauma? Brittany?
Well, I think we balance it in two ways. One, according to what we can handle mentally, especially if you identify with the person who is suffering in those videos. I have not watched the video of George Floyd being killed. I frankly didn't need to know and understand both what that pain is and to understand my responsibility as a living, breathing person to care about equity and freedom for all people and then to go do something about it. The second thing we have to ask ourselves, and this is important to balance too, is why it takes the constant showing of Black carnage and Black death for people to finally care. It shouldn't be that you have to continue to see these images in order to recognize that there are certain people who are being treated well and certain people who are not. And you have a role to play in making sure that everyone experiences justice in this world. Images of Black death are not new. We've seen the lynching postcards in America. We saw the open casket of Emmett Till in the 50s. We saw the video of Rodney King in Los Angeles, and that's just the United States of America. We've seen carnage come to Black and brown people all over this world. The question is not whether or not we need to watch another video. The question is whether or not we're finally going to get serious so that there are no more videos.
I think what's so striking about this particular movement is it is a multi-generational movement. It is a multinational movement. It is a multi-ethnic and cultural movement. But is this movement we're seeing now different than ones we've seen before?
I think so. We have always been successful when movements were intergenerational, when we valued the qualities that everyone brought to the table, whether it's the energy, the wisdom, or the continuity. And so we must put a pause that the civil rights movement was an intergenerational movement. That's why it was successful with SNCC organizers and the mature, wise leadership of individuals like Ella Baker or Bayard Rustin, or whether it was a continuity of the Middle Age. But this time it feels a little different if we can move from protest to power, from power to policy. We are at a juncture where the messages that are being sent from some of our political leaders are negative and divisive. And because of that image, you look at the demonstrators, it looked more like America. We also see the opportunity to seize upon the political opportunity of November, understanding that people can really go to the polls and vote their values. And we should have a value of respecting all human life and dignity. But that vote is not enough. It's the starting place to really inform public policy to change where we are, not only in the United States, but across the globe.
Dr. Gupta, Brittany, do you want to jump in there? I mean, Dr. Gupta, as a medical professional, are there policies that you need to see enacted to help do your job better?
Absolutely. I think everything Derrick and Brittany have said is spot on. Fundamentally, Morgan, the only way, whether you're sitting here in Washington, D.C., or if you're sitting in London, wherever you are in the world, you need people in a public health crisis to trust their elected leaders, to trust public institutions, whether that's the police, whether it's your local doctor, your healthcare system, to do the right thing. And right now, trust is at an all-time low in many cases. And here we're saying, well, we need people to opt into contact tracing. So we know your whereabouts potentially if you've been exposed to COVID-19. There's such cognitive dissonance between that expectation and where a lot of America is, especially communities of color, Black Americans, when it comes to actually wanting to trust those institutions for very good reasons. So there's that tension. And until we have elected leaders that we trust, that are messaging appropriately worldwide, you're not going to have the weapon that you need to combat COVID-19, and that's public cooperation, public trust. So this is the conversation we need to be having.
Morgan, I will just add that systemic oppression and systemic injustice around the world is cancerous to all of us. Whether you experience privilege or you experience the injustice or some combination thereof, together as a world, we are losing out on our best minds. We are silencing our most brilliant voices, and we are losing opportunities because everyone is not experiencing justice in the way that it was meant to be experienced by all people. So this affects all of us, and we should all be just as concerned with ending injustice as we are with saving ourselves and our communities. Look, we have a real opportunity in front of us. The liberation struggle, the freedom struggle across the entire world has had many, many, many chapters, from ancient times to right now, from Brazil to the Arab Spring to Ferguson. We have found connection with one another, not just in the injustices that we face, but in the possibilities that the future represents. Young and old, Black, white, brown, Asian, indigenous, trans and cis, gay and straight. We have so many folks who are coming to the table and recognizing that there is abundance present and enough for all of us to feast and to live well. So we are at a precious, precious moment where we stand on the precipice of transformation, because all of those people have figured out that we are stronger together. And if we build solutions that keep all of us in mind and are truly intersectional, then we can stop returning to the same challenges we've had of old, and we can actually get to building a world that serves us all well.
I want to thank you guys so much for joining us in this conversation. It's a conversation that I think we can all benefit from right now. So thank you so much.